Are you suffering from adrenal fatigue? Does adrenal fatigue even exist? Is the question here. Hey there, I'm Dr. Jim. I just finished writing another article that I'd like to share with you. And the title is Are You Suffering from Adrenal Fatigue? Have you heard of this condition? Well, the term adrenal fatigue was actually coined quite a while ago by a chiropractor and a naturopath in 1998 by the name of Dr. James Wilson. Dr. James Wilson is an expert in alternative medicine, and he observed that some of his patients were always tired even when they got enough sleep. And he found that to be pretty troubling, but very interesting as well. So, these individuals didn't have any other symptoms, but they just felt sluggish. And one more thing that he found peculiar, they craved sodium. I'm tired and I want salt. Okay. He later called this condition adrenal fatigue, which is described as a group of various signs and symptoms that result when the adrenal glands are not functioning at their best. So, adrenal glands, what are they? I can tell you this, they matter. They really matter. And hopefully you have healthy adrenal glands. So the adrenal glands are small organs right above the kidneys, and they respond to stress by releasing hormones like cortisol and adrenaline. This is a part of the body revving up into action to react during stressful situations. For instance, you've heard the fight or flight response. These hormones increase blood pressure and heart rate, and over time, during prolonged periods of stress, the adrenal gland burns out from prolonged production of cortisol, and then adrenal fatigue sets in. It's the result. So chronic stress, we know is terrible. It can kill us. Chronic stress makes our adrenal glands pump out cortisol over and over and over again and adrenaline. And over a extended period of time, they simply become burned out. Here are some symptoms to look for. Think of yourself, think of others. Before listing the symptoms, though, it's important to note, and this is a very, very important note, the Endocrine Society does not believe that adrenal fatigue is a real condition. It's not a real diagnosable condition. That being said, the following symptoms have been documented in both scientific and academic literature for a long time. Feeling very fatigued, craving salt, bodily aches and pains, depression, loss of appetite, and weight loss. A change in skin color, loss of bodily hair, nausea, vomiting, lightheadedness, and low blood pressure. Now, according to the Endocrine Society, these symptoms may be so general that they can apply to many disorders or conditions, including hypothyroidism, clinical depression, sleep apnea, and fibromyalgia, just to name a few. It is therefore up to you to decide who might be right and who might be wrong concerning adrenal fatigue. So the Endocrine Society, they say, nope, doesn't exist, not real. Lots of people in the literature, scientific, academic, anecdotally, individuals believe they may have it. Now, what are the causes? If adrenal fatigue is real, a diagnosable condition, then there most certainly must be causes involved, right? So, possible conditions that can cause adrenal fatigue include the following: adrenal insufficiency, amyotrophic lateral sclerosis, Lou Gehrig's disease or ALS, cancer, chronic kidney diseases, heart disease, hyper or hypothyroidism, liver disease, low vitamin D levels. Make sure your vitamin D is up to par. Parkinson's disease, rheumatoid arthritis, sleep apnea, stress, and traumatic brain injury or TBI. Some experts believe that certain infections like mono or COVID-19, especially long COVID, might be the cause of some adrenal fatigue cases. Now, how do you treat this? Is it real? Is it not real? Are my symptoms real? You probably feel that your symptoms are real. To manage adrenal fatigue, it might be best to focus on treatments and interventions that are very symptom specific. For instance, if you think you have adrenal fatigue and depression is your main symptom, focus on mental health. That might be very helpful. Use relaxation techniques, stress management, meditation, yoga. See a counselor or psychologist. It might be necessary to seek out a physician for antidepressant medication. If pain, on the other hand, is your leading symptom, then physical therapy, massage therapy, counseling, medications, they might be appropriate as well to reduce symptoms of pain. And another example, if sleep is your major issue, seek a specialist, change your personal lifestyle or your routines, or look into medications, either prescribed or all natural, that also might be helpful. Other ways to manage symptoms include maintaining a healthy diet, low in sugar, caffeine, and junk food, and take supplements like vitamins B5, B6, and B12, vitamin C, and magnesium. And here are my final thoughts. The world started hearing about adrenal fatigue in the late 1990s, and while some experts believe it exists, some from the Endocrine Society don't believe that it's real. It's not a diagnosable health condition. Regardless, some people may have clusters of symptoms, which is called a syndrome, that cannot be explained by their healthcare provider. The best thing to do is listen to your body, monitor your own symptoms, learn more about the condition, and then see a physician who can help you. I'm Dr. Jim. Thanks for hanging out for another long topic. I'm writing long articles these days. I don't know why. Are you suffering from adrenal fatigue? I hope you enjoyed the video. And if you're looking for online continuing education, CEUs for your own license, check out CEU Academy, where we create fresh content every single year, very timely, important topics. And tell your colleagues who are licensed healthcare professionals as well. Follow the link below and check out ceu.academy.